morning, Jordan. Thank you so much for being on the podcast today.
Thank you for having me.
Yeah, super excited. So, for parents that might just be hearing this, this is actually the third in a series of four for our sleep study series. So, if you missed it, go back and grab the first two. The first one was with JT, the second one is with Dimitri, third is with you, and the fourth one will be with Dr. Gerald Simmons. So, by the end of the series, our goal is for parents to have a complete understanding of what a sleep study is, what to expect, how to work with your kids, just everything. Just so it's a
Yes,
better experience for everyone.
right. That's so important and helpful.
Yeah, because it's a scary thing. I
It
mean,
is.
even as an adult, I'm kind of intimidated by this. Yeah, well, I'm not now, but I didn't know what went into a sleep study.
No, it is. It's intimidating. You walk in, you see all of the things. Someone's going to watch you sleep or watch your child sleep. It's intimidating, it's scary. And so anything that can make the parents or the patients feel more comfortable and be a little bit more informed going into it, I think is really important and helpful. And that helps some of the nervousness and the anxiety of going into a medical procedure, right? Any medical procedure is scary. And
Right.
so then, if you're anxious, you're not going to sleep. But if you know a little bit about what's going to go on, hopefully you'll sleep a little bit better so they can get better information too.
Exactly. Right. And that's our goal. So
Yes.
before we get into everything, let's just take a minute and talk about your personal journey and how you got into this field.
Yeah, so I got into sleep in a very roundabout way. It was never my goal to even be in healthcare. I grew up as a competitive dancer and went to the Performing Arts High School in Houston for dance. And so my whole life was you're going to be a dancer. You're going to either be on Broadway or with a dance company in the performing arts in some capacity. And I originally went to college in Boston to the Boston Conservatory that's now merged with Berklee College of Music for dance.
Mhm.
And so, like I said, that was going to be my goal. My whole life was dance. That's what my whole life revolved around. Well, an injury kind of set me back and really made me reevaluate, is this what I want to do for the rest of my life? I'm 19. I'm in a ton of pain. I've been diagnosed with arthritis now. Am I going to have to work 5 or 6 jobs just to be able to support my lifestyle that I want? And so I left after my second year, much to my parents' dismay. They were not super happy because it was a very expensive school. It was a lot to move to from Texas to Boston.
Mhm.
And I had spent my whole life working towards something. So I moved back home and I was like, I have no idea what I want to do. I've been to physical therapy. So I thought, well, maybe physical therapy, I could kind of work in my knowledge of just your body and your muscles and how things work. Um, or nursing, because that's kind of what everybody knows. So I went to the local community college by where I lived, just started taking some general science classes, just working towards kind of my basics. And I applied to the nursing program, which is extremely competitive and was put on the wait list. And so, anyone who was put on the wait list, all of the other healthcare programs reached out to them and said, hey, we have these other programs here. If you want to look into something else. And so sleep was one of them. So I went to the information session, and the program director at the time, talked about the program, talked about the career. And I was like, oh, this is really interesting. Like, I didn't even
Mhm.
know this was a career. And so I, on a whim, applied, was accepted, and then kind of the rest is history. And so I've been in
Wow.
sleep since 2013 is when I graduated from that program. So it's just kind of evolved. I loved sleep. I loved the gratification of helping patients, being a part of their health journey. When you sleep not great, you feel not great. And
Yeah.
so when you start to sleep better and feel better, and you kind of get that instant gratification, like, oh my gosh, they slept so good and they feel good when they woke up and they haven't felt good when they woke up in years. So I really loved that part of sleep itself. So
Yeah.
real
And
round
that's
day, but I'm happy I'm here.
yeah, and we're happy you're here too. And it's so funny. I mean, I can relate a little bit. My sister got accepted to HSPVA, and she was a dancer
Oh,
like you.
wow.
And I watched her. I mean, she was my idol, and I watched her and what it did to her body, and now here she is as an adult with arthritis and other things, and you don't you just don't realize. And she ended up becoming a teacher and did special ed and did all these great things. And
Awesome.
it's funny, something maybe your passion and you may be just exceptional at it. Sometimes the universe just kind of takes you
No,
the other way, doesn't it?
it does. And you're young and you don't know how to take care of your body. So maybe you're not doing the best things for it, and then you
And
move
it was
to
such a hard field you were in too. I mean, there people don't realize the wear and tear
it is
on
hard, and
dancers'
it's hard
bodies.
emotionally, it's hard physically,
Yeah.
mentally, it's all of those things. There's a lot of rejection, and at some point you kind of go, is this what I want to subject the rest of my life to? And if it is,
Hmm.
amazing, do it. But it was one of those
Yeah.
things where it was like, can I get out while I can before I invest too much and at the point of almost no return with your physical being and your mental health too.
Right.
So I'm grateful for it. It taught me so much, taught me discipline and independence and things that I never probably would have learned. And as a mom now, I
Right.
see those things in my kids like, oh, I had a lot of independence early on because I was kind of in this trajectory that made you a little bit independent and where so it I'm grateful for it. I'm grateful
Sure.
that it led me to the knowledge that it gave me. So
And you can use that now. That's the other thing I find so interesting. I mean, looking at you and my sister, that's completely different careers than where you started.
mhm,
But like you said, you can take that discipline and you have a different, I would think, perspective of relating to people because of what you experienced and what you had to go through. And you understand pain and chronic
yes,
pain and having to squish it down and just keep moving. I would
yes.
think that actually helps you a little bit.
It does. It helps you relate and have some a little bit more empathy for patients too,
Yeah.
and understanding. Um, sleep itself. When you don't sleep, you feel awful, and it can lead to
Yeah.
chronic pain and can lead to the depression and lead to a lot of different things that you don't even realize kind of all ties back to it. And so, just being able to relate to patients is
It's
really helpful.
huge.
Huge
Yeah. Yeah.
is huge.
Yeah. I would think so. So, okay. So we're going to kind of build on all of this. Appearance, don't think we're just off on a limb here, but stay with us. So today we're going to talk really, we're going to dig a little bit deeper and build on what we went over with JT and Dimitri. And we're going to talk more about what it's like to have a sleep study and to prepare for it and all just the little ins and outs that go with it.
Mhm.
So you are, and I'm going to slaughter this, so I do apologize, a registered polysomnographic technologist. Not sure why that is so hard for me to say.
Got it.
um, so let's just start there. We kind of have a high level because of the two previous episodes of what this role does and how parents would interact with it. So let's just talk a little bit more about from start to finish when you walk in with your child. This is like your Julie McCoy of the night. You will walk them through everything. You're going to guide them through everything. How does this interaction take place?
Yeah, so the role of the sleep technologist is to um, get information from the parent and the patient to apply all of the electrodes that we're going to put on. They also are going to be in charge of the recording and getting all of that data and information for the physician to look at. We're really the eyes and ears as well. It takes about 45 minutes to put all of the electrodes on. So, in that time, the tech is talking with the patient, talking with the parent. And in those conversations, sometimes you learn things about maybe sleep habits or maybe what's going on in their life that could be causing some of these sleep issues that they're having. And so you get a lot of information as well that you don't always get from the physician in like a clinic appointment. And so our job is to get that information, really be the eyes and ears, put on all of the electrodes, make sure that we maintain a really good quality study so that the physician has all of the data that we need because we would hate for you to have to come back because something fell off or we didn't get the information
Right.
that we needed. And then in the morning, we will let you know when the results would be ready. Our scope of practice, we cannot give you any results or tell you how you did. So in the morning, a lot of times I'll be like, okay, well, how did my kiddo do? And it's like, well, we got the information that we need. And then the physician will look at it and run the reports and figure out kind of what's going on with your child and what's an appropriate treatment plan. So we cannot give you any results. We can't tell you, how you did other than, hey, we did get the information that we need. And then we take everything off of them in the morning, clean them up, and then from there, the physician kind of takes over after that with appointments and going over the information that they gathered, the diagnosis, if there is any, and what the treatment plan is.
Gotcha. And as far as your engagement throughout the night, so obviously you're there in the beginning, you're there at the end, and as we saw with Dimitri, you're actually not in the room all night. You're in the facility, you're just in a different location monitoring all night.
Yes. So most places, it depends kind of where you are. If you're in a private lab or a hospital lab, they're all set up a little different, but all the techs are in a control room. And so that can either be right outside of the patient's room or it could be down the hall, but we're very close in proximity. And what we're doing all night is you're being recorded video wise, and that is just to see what position you're sleeping in. Are you kicking your legs, doing any kind of weird movements that is not typical for sleep? That's going to help with a sleep disorder diagnosis. We're also looking for, are you talking in your sleep? Are you audibly snoring? Where not only are we getting a signal on our snore sensor that's on their neck, but also can we hear you snoring?
Mm.
There's an intercom in there. So if you have to get up or you have anything, you just talk out and we can hear you and communicate with you that way. And then we're also monitoring all of those electrodes that we have on you are displayed on a computer screen. And so we're monitoring that all night long. And so our job is to make sure that all of those electrodes are staying on. We're getting a good signal. And then we're also making sure, are you safe? So if something starts to change clinically, and do you need any interventions? We are observing you that whole time. So if anything changes with your heart rate or your breathing, or your brain waves, even, we're monitoring that. So if we need to intervene in any way in that capacity, we can. So yeah, we're with you the whole night, even though we're not right there next to you. We are watching
Right.
all night long. We don't leave the facility. We're right there with you, and making sure that we are safe and that we're getting really good information. So the physician has really good data to look at to come up with a diagnosis and a treatment plan for you.
Right, which makes total sense. And then the parents, and just to clarify, so that parents, if they didn't hear it before, they are in the room with the child all night. Your child is never alone.
Correct. Yeah. The minors, we can't leave them alone. So if they have to run out to their car, they need to take their kiddo with them. Usually they allow one parent to stay and they sleep in the room with them, whether it be like a couch or a pull-out bed, depending on kind of what the facility has. But they will be with the patient all night. They don't encourage the parent to sleep in the same bed as the child, if possible. And that's just for a couple of reasons. So the snore sensor is a lot of times a microphone. So if the parent's snoring right next to the kiddo,
Oh,
you can
yeah.
pick it up and think it's the child. Or if the parent's moving around, it moves the kiddo around and makes it look like maybe they're waking up more often than they really are. But if that's the norm and that's the only way your child sleeps, the most places will allow it. And then that may be a conversation of, is this our normal? Is this just because it's a new environment and so they need your comfort to be able to fall asleep, and then kind of go from there? Or is it they don't sleep and this is the only way I can get them to sleep, right? And so it's just what I've had to do for them and for me. So that's our normal. And those are conversations then that they can have with the doctor to kind of go, okay, how do we go from here? And so all
Right.
of those things are just good observations that the tech is observing as well. And they may ask those questions too of, is this a normal thing? Is this just because we're having a sleep study and they're a little nervous? And then they're just documenting that. The tech is not judging anyone either. A lot of us are parents, right? You do things as parents that you're like, maybe you said you would
It's
never
what you have to
do.
do,
It's what
right?
you have to do. And so if they're writing those things down, it's not to be judgmental or to ridicule or anything. It's just to kind of be the eyes and ears for the physician. So they have an understanding of, hey, yeah, the parent is sleeping with the child because this is the only way they can get them to sleep. And for
Yep.
their well-being and the child's well-being, this is what they've had
This
to
is how
do.
we're going to test it.
This is how we're going to do it. Yeah,
Yep.
exactly.
Yep. And that's one thing too, by the way, just to remind parents, I think that is an excellent reminder. When it comes to sleep and airway issues in general, if you're just finding the podcast and CAF and starting to learn about airway and health, take that mom or dad guilt and park that just out of the way. We want no part of that. I didn't know with my kids.
Mhm.
And, and I'm here,
Right.
and to your point, as a single parent, my tiny people hung out with me a lot,
Mhm.
right? Especially, when we'd moved into a new place, or it happens. We all do what we do as parents, and we're doing what we think is best for our children. So it's
Yes.
all good,
Yes. And even
right?
being a sleep professional, I mean, my kids have slept with me from time to time. My oldest, he was a terrible sleeper. And I knew all the tips and tricks and things, right, from being in sleep, but
Mm-hmm.
still had issues with him sleeping. And
Yeah.
so it's really important to be honest with your sleep tech. And sometimes it's easier to be because they're not that physician. They're sometimes easier to talk to. And so, really, letting them know, like, hey, this is what we've had to do because maybe you've had a big life event that has happened and your kid is going through some things, and that's the only
Yeah.
way they're finding comfort. That's okay. It's not this taboo thing that you don't want to tell. It's really important for the physician to get the whole picture of what's going on
Mm-hmm.
so that they can support you. And if your physician's being judgy or rude, find a new one, right? There's
Exactly.
so many out there that are going to be supportive and understanding of your situation or whatever is going on with your life. um, that it's important to find one that you feel comfortable with and feel like, okay, this is a good thing that
Right.
here. Yeah,
Exactly. Right. Because we're all walking each other through this journey together. You want the people surrounding you that you can trust and be honest with and not have that judgment,
right.
because this should be a judgment free zone.
Yes.
I totally agree.
Yeah.
Okay. So let's talk a little bit more. So, parent, child, we've entered the facility, we've met our tech,
Mm-hmm.
we're having a good time, we're calm, we're giggling, right? We're getting the tiny person all hooked up. Now, Dimitri showed us a couple of items so that parents can kind of get some of their bearings, but there's a lot of equipment that is about to go in this tiny person.
Yes, there is a lot, and it all serves a purpose. So you walk in, a lot of times it may already be plugged into a little head box. There's a lot of colorful wires, there's a lot of things. And so when we're doing a sleep study, we really want to get all of the information that we can from the patient head to toe. So
Right.
their brain waves, their eyes, chin, snoring, breathing, their heart, their legs. We want to look at a lot of different things. And that is one so that we can get all of the information in one setting. You're not having to come back 3 or 4 times to
Okay.
get all of that information. And like I said, it all serves a purpose. Sleep is relatively new in terms of technology and healthcare. And so there are a lot of really cool things coming out that are hopefully going to reduce the number of electrodes and things that we have to put on the patient. But for right now, there is a lot and it is overwhelming. It's important to know that
And no needles, by the way,
no
no
needle.
needles.
Yep,
They're
nothing.
all just sticky.
They're all sticky. If anything hurts, tell your tech. Um,
Mhm.
can it be a little uncomfortable just because it's a lot of stuff? Yes, but nothing
Yeah.
should burn, hurt, irritate you. If it does, please tell your technologist. Um,
Ooh, which that's a good uh, question. What if your child has latex sensitivities? Will any of this bother them, or do they need to tell the
So
tech
they would
that?
tell the tech ahead of time
Okay.
because they could use some different tape. They can put the electrodes on a little bit differently in terms of cleaning the site that we put the electrodes on. So if your child has any allergies, sensitivities, blonde kiddos tend to get a little red with the cleaning solution that we use.
Interesting.
Really normal. But and it may kind of not burn, but tingle a little bit. If it tingles for a few minutes and longer and isn't going away, let the tech know. They may have to take the electrode off, wipe underneath it with a paper towel, make sure they get it all off of there and put the electrode back on. That's the only thing that sometimes causes some irritation is the solution that we clean the patient's scalp with for where the electrodes go. Sometimes can be a little irritating just because it's a little bit abrasive. It's kind of like a toothpaste consistency with little beads in it, and it's meant
Oh,
to clean the skin, get any dead skin, oil, dirt, anything from where you're going to put that electrode. And so, because of that, can be a little irritating. So, if it's lingering and your child's kind of like, oh, my head's burning or itching, let your tech know because they can make sure they go in and really make sure they got it all out. And so that it stops irritating them.
so maybe they could, if you have a child that's sensitive,
Yes,
maybe they could test the arm or something when you first get
exactly.
there.
Yeah, and
Okay.
if your kid has some sensory issues too, um,
Mm,
a lot of times we are standing behind the patient, and sometimes that can be a little jarring to the patient because they can't see what's going on. So a
right.
lot of times the techs will take their hand, the patient's hand, scrub a little, actually put the electrode on their hand so they can see what's going on before they start putting all the electrodes on their head. So yeah, if your kid has any sensitivities, any sensory sensitivities, bringing things to distract them, letting the tech know, being involved. Don't feel like as a parent that you can't be right there next to them, helping, talking through. Some parents feel like, oh, I'm going to be in the way. I'd rather you be in the way and me tell you like, hey, you want to sit down? I think, I got this. Or then you kind of sitting off to the side and your kid freaking out because I'm a stranger. I'm putting all of this
Yeah.
on them. So, don't be afraid to be in there, ask, what can I do to help? Bring those iPads, bring whatever games,
Right.
snacks, whatever you need to do to kind of be able to distract them a little bit. Because it's a little scary, especially if they're
Sure.
younger or they don't truly understand what's going on and we're messing with their head and putting all of these things on their body. It can be a little uneasy. So,
Well, yeah, and especially if you think about, and it didn't even occur to me until you said it. To them, you're the stranger and you're touching all over them. And we've all had surgery, and so you have to lift up your shirt, put an electrode in. So, here's the stranger all over them. So yeah, I could see maybe sitting beside them, talking to them is going to help them realize it's okay. Because we've spent so much time saying, don't let a stranger touch you, don't do this. And now you're
exactly.
going to be all up on them.
Going to be all over them, and having pajamas that are looser are helpful too, so that we can just kind of put stuff over the pajamas, or if we do have to put in the EKG electrodes, we can just kind of gently put them in and they don't have to take anything off or anything like that.
Is like a t-shirt and
Yeah,
Lucy shorts better
yeah.
or okay.
um, whatever your child's comfortable in. Two pieces ideal. The electrodes that we put on their leg is going to go kind of under their knee on that muscle. So if they have pants on, we need to be able to roll the pants up at least to their
Uh,
knee to put those
okay.
electrodes on. So if they're tighter, they just still are they stretchy enough that we can get those electrodes on their leg and then still be able to kind of pull the pants over, or shorts are great. Anything that's comfortable that we can still put the stuff kind of over and still get to everything without them having to take anything off.
Okay. And what happens if the child suddenly has to go to the restroom in the middle of the night? Nothing has to be removed, right? We just kind of march it into the bathroom with them
Yep.
and then march them back.
Exactly. So, like, there's that intercom in the room, so they can yell out. You can yell out as a parent, hey, they got to go to the bathroom. We'll come in. The box that all of the electrodes are plugged into detaches from the wire that kind of sends all the signals to the computer. So, we'll detach it, give the box either to the patient or the parent, depending on their age, and they go to the bathroom. They're wearing everything. And then they come back and we just plug that right back in. If anything falls off in the trip, we can put it back on. It's no problem at all. Diaper changes in the night, totally fine.
Oh yeah,
Just
good
let your
point.
tech know, especially if your kid is maybe older and has bathroom needs. Letting the tech know, hey, if they have to go to the bathroom, we got to go quick. Or, hey, I need to change their diaper, or they have feeds in the night, anything like that. Let your tech know before
Yeah,
you get started so they can know priority. You know what I mean? Like, okay, this
yeah,
patient said they have to go to the bathroom. I need to be in there quick, and getting them to the bathroom and things like that. Or if they need diaper changes, I may have to take off those leg electrodes just to unsnap them so they can change the diaper real quick and I could snap them back on. All of those things are just helpful to tell your technologist before you get started so that they know like, hey, I'm going to anticipate this
this is
happening
happening.
so I can be in there to help the parent.
Okay, and that makes total sense. And it's interesting. The other thing I was just going to clarify because I do believe Dimitri touched on this, especially with the youngers. Routine is so
So,
important.
yes.
So if they're used to a nighttime snack or, hey, we can watch a little Disney or whatever it is, I'm going to read a book, you can bring all that to the facility and still do all that, correct?
Yes. We want to see the patient's normal, right? What does their every single night's sleep look like? Now, you're in a different place, in a different bed, but
Right.
trying to keep as much of that routine as possible. So, one, that they're comfortable, and two, we can really kind of see, is it normal for your child to ask for all of these things and then take an hour to fall asleep? Or is that kind of abnormal because they're in a different environment? So, yeah, if they have a special snack or a bottle, anything that they need, make sure you bring with you. Most sleep labs do not have snacks or drinks. They may have a water or something like that, but anything that you need, bring with you. It is considered an outpatient procedure. So, if they need formula or diapers, make sure you bring all of that with you because they may have, an extra diaper or two, but they won't have any formula. They won't have anything kind of specialty that your child may need. So bring everything with you. The more the merrier. If you don't use it, that's okay. You had it with you just in case.
And we're
Um,
talking blankets, stuffed animals. What if they have one of those little night lights that lights up the room? I mean, just
Yeah, totally
anything.
fine.
Okay.
Anything that they need, if they have white noise. A lot of pediatric labs have
Oh,
white noise machines in the lab, but if your child, has to sleep with this certain rain sound, that's my children. They all fell asleep to the same exact rain sound. To this day, they can't sleep without it. So it would be
yep.
something I bring with me, just so that I had it just in case. Anything, bring a suitcase if you need to. That's totally fine, of whatever it is that they need so that they're comfortable and that they're going to sleep. Because if they come and don't sleep, they're going
Yeah.
to probably have to come back again because that's the whole point, right? We need them to sleep. We need to be able to see what's going on with them, and what is their norm
Got it.
in the
Got it.
morning. If it took them a long time to fall asleep in the morning, tell your tech that, hey, that's not really their normal. Or yes, that is
Mm.
their normal. And the tech will just write that down. And that'll help the physician know as well. Okay, yeah, it took them longer to fall asleep, but that's not an issue they normally have. So we're going
Gotcha.
to chalk that up to being in the sleep lab. Or, yeah, they normally take an hour to fall asleep and they did that tonight. That is their normal. That's an issue that the parents are dealing with. And so all of those things are just super helpful because, again, we're the eyes and ears for the doctor. And so
Mhm.
anything you share with us is super helpful in the doctor coming up with a plan for your child and for you.
Which makes sense. And
Mhm.
I mean, I would assume you would know these things before they get there, but do you handle it differently? Should the parents prepare differently if you're the parent of a child that has Down syndrome, for example, or severe ADHD, or is on the spectrum? Does that change things? That change how you as the tech would work with them, or is everything still pretty
Yeah.
consistent?
Yeah. So I would, I approach everything the same way. I go in, try to feel what's the vibe, right? How is the kid interacting just from the time we walked from the lobby to the room? How is the parent interacting with them? I think it's really important for if the child has anything like they're hyper, they're not going to sit in that bed. Okay, they don't need to sit in the bed until we're ready to get going. All of those things are super helpful for us. Anything we know ahead of time would just help us with how long it may take us to put those electrodes on. Is your kiddo maybe going to need a break halfway through? Because that's a long time for them to sit. Can they not sit for 45
Mm.
minutes? Is it am I going to need another tech and maybe we can tag team it to speed it along? All of those things are just kind of good for us to know to judge how long is it going to take us to get everything on your child and to get the study going. Insurance requires at least 6 hours of recording.
Okay.
So we need to prioritize a little bit timing. We have plenty of time, but also if your kiddo is going to need breaks or if we anticipate it's going to take a lot longer to put everything on them, how do we gauge that so that we can still get the amount of time that we need of recording?
Maybe bring him in earlier or something like if you know ahead of time.
Yeah, or grab another coworker and say, hey, we're going to
Right.
tag team this. And that way we can get it done a little bit quicker. If possible, I can have some toys pulled out already, or Child Life maybe can bring some sensory things and already have that available if those are things that are helpful. So anything that you can tell ahead of time, whoever calls you to kind of confirm your appointment is so, so helpful because that gets relayed to the techs and then they know kind of what they're going to be walking into and what they can anticipate a little bit throughout the night.
Which makes sense. So speaking of walking into, excellent segue. So let's talk a little bit about, as the parent, you're there at night and boop, tech shows up.
Right.
So that you're not startled and you know what's going to happen. What are some reasons the tech may come in? And then when the tech is there, as the parent, is it okay to ask questions? Do we just need to be quiet, just kind of wave? And
Yeah.
what's the protocol for that?
So whatever you're comfortable with. If you have questions, ask those questions. They may not be able to answer them because of our scope of what we can and can't answer, say, or give results or information or things like that. But don't be afraid to ask them. If they don't know the answer or can't give you the answer, they'll tell you that. If we have to come in the middle of the night, a lot of times it's because an electrode has either fallen off or they're laying in a position that we're not getting a good signal or a good reading. Or maybe we're getting a kind of a weird reading on our computer and we want to come look, lay our eyes on your kiddo and see, is that accurate? So that'd be something in before the study starts. A lot of techs will ask the parent, do you want me to wake you up every time I come in the room? Is it okay if
Mm,
I just kind of sneak in and try to fix what I need to fix? Let you sleep, let the kiddo sleep. What are you comfortable with? Those are questions that the tech should be asking the parents. Doesn't always happen. Things can get a little busy or they can get a little flexible.
sure.
So if the tech has to come in the middle of the night, it's usually to fix one of the electrodes or sensors that are on the kiddos. Kiddos like to be a little bit snotty, and one of the electrodes that we put on is like a nasal cannula, like you would give oxygen.
Hmm.
We're not giving oxygen, we're actually measuring the pressure of the air coming out of your nose, but it gets moist, especially if they're a little bit snotty or been crying. And if any moisture gets in there, our signal is not so fabulous. So we may have to come in, clean it out, or replace it completely. And that's a common sensor issue that we have, especially with little ones that are a little bit snotty or they've been crying or anything like that.
Yeah.
Um, the pulse ox that we put either on their finger, on their toe, sometimes they like to play with it because it has a little bit of a red light on it.
Yep.
So if they pull it off or we're not getting a great reading, we'll have to come in and move it around. So any reason we come in is just to fix any electrode that it may be. And so a lot of times we can come in and kind of sneakily fix things without ever waking up the patient or the parent. If for some reason they come in and they say, hey, we have to put a CPAP mask on your child, and that was not planned. That could be because they did show obstructive sleep apnea and it was severe enough that we need to intervene in the middle of the night and put a
Okay.
PAP mask on them and go ahead and put them on PAP. Um, If it was ordered for the study to be that way, like a half and half, half diagnostic, half treatment, we would have discussed that ahead of time before the study started so that you knew, hey, there's a possibility I'm going to come in the middle of the night, put this mask on your child, and this is what the purpose is to
And
help
that's nice because the child
you.
can see it too, so they're not startled. Yeah.
Yes. Now, sometimes it's not planned. It's they're so significantly having some issues breathing that we need to come in and intervene in the middle of the night. And if that's the case, we'll wake the parent up, let them know the purpose of it, put the mask on the child, and start our titration in the middle of the night. Um, and that's rare. It doesn't always happen. If they're there and maybe they have a trach and we're doing some trials of capping their trach or uncapping their trach, we may be coming in and maybe it was planned to be capped, but they're not doing so fabulous. So we need to come in and uncap it. We would wake the parent up and let them know so that they understand kind of what's going on with their child as well. And we're not just coming in and doing a bunch of things and they're sound asleep and they don't know what's happened. Um,
Right.
so, whatever you feel comfortable with, if you have a medically complex child in any capacity, ask those questions. The tech may not always know it or know what answer to give you, but they can at least write it down and let the physician know that, hey, the parent had a lot of questions about their trach or about next steps or what is this going to look like in the future so that the physician knows they need to discuss those things with you when you have your clinic appointment.
That makes total sense. Okay, so let's say we've gone through the night. You got this, at least 6 hours that you needed recorded. How does this wrap up process
Yeah, so
go?
we'll come in the morning and we'll let you know the study is over. We have to do some things called biocalibrations before we take everything off. And that
Okay.
is an insurance thing to show that, hey, yes, everything was working throughout the night. We did them before you went to sleep, and then we do them again when you wake up. Just simple things. We ask you to open your eyes, close your eyes, blink, breathe normally, move your legs. It's just to check all of those sensors and electrodes that we have on you to make sure that, yeah, they were working throughout the night.
Okay.
Once we do that, then we'll come in and we'll unhook you. So we'll take all of the electrodes off of you, clean up your head. You probably will have some gunk in your hair. It's the paste that the electrodes
Yeah.
stick with and conduct electricity. Shampoo and lots of conditioner. It's heat activated. So the hotter the water, the better it kind of melts away. But you will have some of that in your hair. The tech will try to clean it up as much as you can, but plan to be able to go home and really scrub your patient's hair.
Mm.
Um, they may
And the
have
body too. It sometimes it
body.
leaves it on there too.
So we'll have sometimes you'll have tape residue.
Mhm.
Some patients, we have that electrode on your neck that's for your snore, and we tape it down. Sometimes when you take that tape off, they'll have a little redness around it. Totally normal. It's just from having that tape on for so long.
Right.
So we try to use some tricks like alcohol pads or hand sanitizer to put on the tape first, so we're not ripping it and giving you
Mhm.
a wax job very quickly. We
Nice,
try to be
right?
nice about it. So we'll take everything off. There may be paperwork that you ask your child, depending on their age. How did they feel like they slept? Did they feel like that was normal? Did they feel like they had any dreams? They'll ask those kind of questions. They will let you know the typical time that it takes for the physician to read the study and get back with you. So whether that be a couple days, a couple weeks, let them know, hey, someone will be contacting you to schedule an appointment to go over your results. Again, we can't give you results in real time at that moment.
Right.
So you may feel like they're a little vague with you, but it's just because we can't give you that information as much as we would love to sometimes because we kind of know what was going on. Answer any questions, and then you're free to go after that, free to go home. Usually they don't serve breakfast, so they tend to wake up about 6 a.m., get everything off of you so they are out of there by about 6:30 in the morning is typical for most pediatric sleep labs.
Not bad. Yeah, so you can actually get out.
Yeah,
Um,
if you need to get to
so
work or kiddos get to school, you have time to
right,
do.
right. So as far as a sleep study itself, just for kids, because I mean, as you mentioned, I mean, it is a new field, but especially for kids and as parents, I mean, this is a whole new world for most of us. So why would a child need a sleep study, and why are at home studies really not great options for our tiny people?
Yeah, so there's a couple reasons. So there's
Okay.
80 plus diagnosable sleep disorders. So a lot of times the physician may not truly know what's going on with them. So the best thing is let's have a sleep study and try to see what is going on with their sleep. A lot of times it's the parent has witnessed them sleeping with their mouth open a lot or snoring. Maybe even the dentist has seen some decay in their teeth because they're sleeping with their mouth open. If they have a larger tongue, a lot of times before they get their tonsils and adenoids out, they'll have a sleep study. Then say, yes, they have sleep apnea. Let's take out their tonsils and adenoids, let that heal, have another sleep study to make sure everything is resolved. That's a lot of what we see is the tonsils and adenoids, if they're enlarged, want to see if, hey, is it causing some issues? Yes, okay, let's take those out and see if those issues resolved. It could be they have a respiratory illness, and we need to get that long term data of their oxygen, their carbon dioxide, their breathing. What does their heart look like? Do they have a trach? How are they doing with their trach throughout the night? Do they still need to be on a ventilator or any sort of respiratory support at night? We see that a lot. They're overweight or they have Down syndrome where they typically have a smaller mouth and a larger tongue. So as we sleep, our tongue likes to fall back, and is our tongue falling back and closing off our airway. So different childhood diseases and disorders have a lot of sleep issues because of either anatomy or their lungs need some more support. And so let's get a good comprehensive data of what it looks like when they're sleeping for a long period of time and see what kind of support do they need throughout the night. So that's a lot of what we see. Home sleep testing doesn't record as much as an in-lab study. So in an in-lab study, we're recording your brain waves, we're recording your eye movement, your chin movement. If you're snoring, are your legs moving? How are you breathing? What's your oxygen? What's your carbon dioxide? What's your heart doing? So we're recording, like I said, a lot head to toe. For
Yeah.
a home study, we're only monitoring a few parameters, mostly
Okay.
respiratory. So we're not
Okay.
going to have those brain waves. So I'm not going to be able to see how much sleep you actually got. I'm not going
Oh,
to be able
okay.
to see how often did you wake up throughout the night. We're not going to be able to maybe see what your heart rate was throughout the night or if you snored, depending on the type of home sleep study that you had. So there's different types that record different parameters. Most of them, like I said, are going to record your breathing. So they may have a chest belt and they'll probably have a pulse ox. So we'll know your heart rate and your oxygen saturation, but we won't be able to see your heart rhythm necessarily like we can in an in-lab study. So it's just less parameters. It's really to see, do you have sleep apnea or do you not? Not necessarily looking for some of these other disorders. So
Not to
in
sound kind of snotty about this, but just to clarify, because I know if my mind went here, someone else's mind went here. It kind of sounds like just in general, home study is really not much better than your Apple Watch. I
yeah,
was thinking you could record a little bit more, but I guess you really can't, can you?
yeah. So, and that's where the technology is coming out is really how do we record more with these home studies
Yeah.
without having the patient have to put it all on. So you have to remember for a home sleep study, the patient is responsible for putting those items on themselves. So we want to make it as simple as possible.
Right,
For
right. Because what
example,
if you put
there
the monitor in the wrong
yeah.
place and you're going
And
to get
there's a
nothing?
lot of room for human error. There's a lot of,
Yeah.
if something falls off, there's not someone watching you to say, oh,
True.
we need to put that back on. So for home studies, it really was designed for adults who probably have a really high pre-test probability to have obstructive sleep apnea. So maybe they've met with their primary care doctor and the doctor is like, yes, you have OSA. Insurance doesn't want to pay for an in-lab study because maybe they're otherwise relatively healthy as an adult. So they'll pay for a home sleep study as like a, let's see, do you or don't you?
Okay,
And
got it.
so the home sleep study can give us the information of, yeah, they probably have OSA, so we can treat them. Or maybe it was inconclusive and now insurance will pay for an in-lab study.
Gotcha.
Kiddos,
But we can't really narrow it down to you're one of these 80 with the
yes,
home sleep study. It's
exactly.
literally kind of a yes or no.
Exactly. And
Okay.
so with kids, we really need to be able to identify what is going on with them. And so in the world of sleep, 13 is kind of the age that they categorize pediatric and adults. So
Okay.
when we're looking at sleep, pediatrics is considered 12 and under, and 13 and over is adults.
Okay.
However, the physician can use the pediatric rules for 18 and under. So that's where the
Hmm.
home sleep study is like, it's not approved for anyone 13 and under, because that's where in the world of sleep, our rules and guidelines separate 13 as you can use adult rules for interpreting and treating your patient.
Okay.
So, with that said, most 13-year-olds are still probably having in lab sleep studies, unless it is maybe they're just overweight and the doctor's trying to see how much is maybe their overweight affecting their sleep, and things like that. So, that's where that home study is really more designed for our adult population who don't really have a
Gotcha.
lot of health issues or medical issues, and insurance is saying, hey, we're only going to pay for this.
Right.
And so we're going to start there.
Okay.
Versus kiddos, insurance will pay for an in lab study and allow them to get that more comprehensive data and information for the physician.
And it kind of makes more sense to me too that we would definitely go that extra step. Like we're going to skip this and just go straight for the big money because these are developing
Yes.
humans and we've got to get to them fast because this is impacting their brain and their brain functions and their overall health, and they'll carry this into adulthood. So I understand the urgency. It does make a little more sense.
Yeah, and insurance, and as sleep is becoming more recognized and more of a topic that general practitioners are having more knowledge of, that they're being educated on more in medical school and residency, and it's just more of a commonplace that we're seeing the importance of good quality sleep and overall health outcomes, right? If you have sleep apnea that's untreated, you're more at risk for heart attack and stroke and high blood pressure, gaining weight, diabetes, all of those things. So if we can treat their sleep and lower their risk for all of those other things, why wouldn't we do that? And
Right.
insurance is starting to realize that as well, that hey, if we maybe spend a lot of money up front, but it can help them long term, to help kind of mitigate and hopefully reduce their risk for a lot of other health issues. Same for kids. We're seeing their school performance suffer because they're not getting good quality sleep. Kiddos who don't have good sleep are not necessarily fatigued and tired. They're super hyper and
They're
crazy.
ADHD
They're
like.
ADHD. And so there's that correlation now of, are these kids really ADHD, or what does their sleep look like? Are they just not getting enough sleep? Is that education that the pediatrician can help the parent with? So now more pediatricians are having those conversations with, hey, a 6-year-old still needs 10 to 11 hours of sleep. So, yes, they may be able to stay up till 9 o'clock, but if they're having to get up at 6 o'clock for school, that may not be good. And so we may see these negative behaviors or things that can just be mitigated by going to sleep an hour earlier. Little conversations like that are happening more and more as more information is coming out and more research is coming out showing how important good
Good
quality
sleep.
sleep is for everybody, for
Yeah.
babies, for kiddos, for teenagers. Okay, teenagers like to stay up all night. Well, that's normal because of their hormone
How
changes.
they're wired. Yep.
So their circadian rhythm is changing. So it kind of helps the narrative of later start times for school and high school
Exactly.
and all of those things. So as sleep is getting more research and more mainstream, I think we're going to start to see the emphasis on really supporting patient sleep and supporting them as their overall health.
Yeah, which I love that. And by
Yeah.
the way, it just doesn't hurt to mention this again. If you go through this with your child and previously they've been diagnosed with ADHD and you've been giving them medication and we find out it was an airway or sleep issue,
Right.
please don't feel guilty. You were
No.
doing what you thought was best for your child.
Yeah.
You did what you know, and here's where you are now, and keep moving on.
Yep.
It's all good.
It's all good. And it's one of those things you don't know what you don't know. And if you were never educated on how much sleep your kiddo needs, or they're doing all these extracurriculars, you have to get up to go to work. So maybe they're going to daycare before school because of your job schedule. That's okay. And
Yeah.
so, what are some little changes that maybe we can make to support not only you, but also support your child? And reevaluating constantly of, hey, all of a sudden we're starting to have issues and we've never had issues before. What are some little things maybe we can start changing and see, do we see a change in behavior? If not, that's okay. There's true ADHD kids out there. It's not always a
There
sleep
are.
issue.
Right.
But sleep is a big, big issue. And especially in kiddos when they don't act tired, or they get that
Mhm.
second wind and get real hyper at night. Sometimes they're
Yeah.
overtired and then we've kind of missed that window to get them to sleep. And that's okay. And I'm seeing pediatricians, even from my first child to my third child, where the pediatrician is now educating on sleep and how much sleep they need and what is normal sleep at different ages. Where with my first, he never expressed that to me and he didn't even know I was in sleep. So just the education in general that parents are getting and their pediatrician appointments, I think is improving too and helping with that narrative of
Yeah.
getting good quality sleep.
I totally agree. And I'll put links in the show notes to some of these things, but there's some really, really great books if you want to read some of them. There's, Why We Sleep, which is a fantastic book. Of course, Sleep Right Kids, Sharon Moore, fantastic. And that gives you, as a parent, a lot of um, sleep hygiene and a lot of tips that you can do that, like you've been discussing, that you can try with your child. Brave Parent is another one. We'll put a link to that one in there. And then our website's got some really great stuff. We've collaborated with some of these authors, so we're not just pulling this out of thin air. But there's also the Texas Sleep Society and the Sleep Education Consortium.
Mhm.
I mean, and that's for physicians and allied professionals as well. Check out these resources. But as parents, as you mentioned, there's 80 different diagnoses you can come up to. Head on over to the Sleep Education Consortium and check some of these out, because I think as a parent, once you understand and you have this knowledge, you can make better decisions and help
Yes.
your child.
Exactly. And it goes back to that guilt, right? We don't know what's going on with them. And then you feel like, oh, is it something I did? Did I
Right.
set them up with good sleep habits? Or we had this great schedule, but we had this huge life change and job changes, and maybe we had to move or whatever. And now they're all out of whack. It's okay. It
Yeah.
happens. Or it happens even with us as adults, right? We go through
Sure
ebbs
does.
and flows of our sleep. And so there's so many resources out there, like you said, now that you can find, even if you're just searching. I have a 6-year-old boy. How much should he sleep? Right. And there's
Mhm.
tons of data out there. And oh, my 6-year-old is having this issue. What could it potentially be? Because a lot of those AD sleep disorders are more adult based or maybe
Mhm.
more age based. And little kids, we see a lot of sleep talking, sleepwalking, night terrors. All of that's normal. We expect them to grow out of it as they get older. Um, it's due to how much deep sleep that they get. So sometimes it's just looking at those things and realizing, okay, yeah, night terrors are terrifying for the parent, but the child has no idea what's going on. They are sound asleep when it's happening. They will not remember it
I
in
was
the
gonna say they're not gonna remember it.
They're not
That's the
going to remember
wild
it.
thing.
So sometimes it's just giving yourself that peace of mind of my child is standing screaming at midnight.
Yeah.
And it's hard for the parent, but the kid has no idea. They're going to go back to sleep. They've been asleep the whole time. They're going to grow out of it. So just sometimes giving the parents some of that peace of mind is super helpful too. So like you said,
Yeah.
there's so many resources out there. It can be daunting, but
Yeah.
ask your pediatrician. Start there. If they don't know,
Mhm.
then say, hey, who can you refer me to? You may
Yep.
go to a sleep doctor and they say, no, they don't need a sleep study. Maybe let's just keep a sleep diary for 2 weeks and kind of see what is normally happening.
Mm-hmm.
Medications affect sleep a lot. So if your kiddo is on some medications, look up the effects of sleep on it. Is it something, maybe it just the time of day that they take it changes. So there's a lot of little tweaks that can be made that can help your sleep.
Yeah, and I'll just throw this out here, like if I were a betting person, because I've heard this from other parents, and I went through this. I'm sure you went through this because I've heard this from other guests. As you're going along your child's sleep and airway journey, and you're doing your research, you're going to these websites, you're reading the books, you're listening to the podcast, you're talking to your providers, you're going to have these moments where you look in the mirror and go, "Oh," because you realize, oh, I could be doing better. This is impacting me. I mean, I come from a long line of people that wore the fact that we got about 4 hours of sleep because that's just how we're built. Like I came out of the womb not sleeping. That's
Yeah.
I've heard this my entire life as a badge of honor. And
Yes.
people would always joke with me, why do you ever sleep? No. Well,
Mhm.
guess what? Your girl sleeps now. I've worked really hard to tell my body, no, that's not good for you because you also start, as you do the research, looking down the road. Wow, dementia, Alzheimer's runs in my family, high blood pressure, diabetes. Guess what's all related to sleep and airway? Like
Yes.
mind blowing. And you realize, oh, I didn't know. My parents didn't know. Let's make some changes. And I think that also trickles down because now your children are seeing mom or dad is adjusting and look at what it's doing for them. Oh, maybe it's not so scary. I can do it.
Right. It's how we prioritize eating, right? We prioritize maybe, okay,
Yes.
I can start changing little habits here and there. Same way with sleep,
Mm-hmm.
prioritizing sleep
Yeah.
as a prescription almost of how
Yep.
much sleep should I get? What kind of little things can I change? How can I adapt my schedule to support me? Because I will ultimately feel better if I'm getting the amount of sleep that I need. Women need more sleep than men. We have different sleep needs throughout the month, depending on our
Mhm.
hormones and our cycle and things like that. And so understanding that and prioritizing that, like you said, it trickles down. Your kids watch everything you do, whether you
They
realize
do.
it or not. So if they
Mm-hmm.
see mom and dad going to bed and shutting everything off and having a nice, cool, quiet environment, they're going to do that too. And all of the things that I used to fall asleep with the TV on because that's what I did as a kid, because that's what my parents did. And so then
Exactly.
I did that. And then learning, oh my gosh, those light, those blue light and all the light that I'm getting, it's impacting how I'm sleeping, even though
Yep.
I feel like I'm sleeping, and making those changes. And it's not wrong. It is what it is. And
It
so
is
what
what it
little
is.
changes can we make that then will support our kids too? And they'll do better.
Yeah.
They'll have better attitudes. They'll have less meltdowns, right? If they do have any chronic illnesses, those will hopefully improve a little bit because their body is now able to rest and repair the way it's intended to when we're sleeping.
Yep. And I will tell parents that don't think it's real. As somebody that has been through this process, because I do have an airway disease, which I even hate using the term disease.
I
Just have an
know.
airway issue. It's been 20 years, but it's an issue. Um, these changes, the little things make impacts. There's meds I'm not on anymore. I actually do sleep 6 to 7 hours a night, which is phenomenal.
That's great.
I'm not tired during the day. And yeah, I do still have the airway issue, but just these little changes, it
Yep,
does matter.
it does.
Right. So, yeah. And take advantage of something as simple as your phone. You can mute it at night. You can set it up to where it goes into hibernation at night and only certain people can get
Can
through. My peoples are away at school because they're older, but if they need me, I will hear that, but I
right.
won't hear anything else at night. And you think, oh, that's not a big deal.
It's
But
a
these tiny little sounds, and every time your phone goes off, the light comes on, you
yes.
don't realize it, and it does make an impact. So
It
just
does.
do your research and check out these books and these websites, and you're going to learn so much. And
No, you really are. And even if you can just find a sleep hygiene handout, there's some great picture ones too. And just give it to your kiddo if they're at the reading age or understanding age and say, okay, what are some of these things that maybe we can all do as a family and make it like a
I
whole
love that. Yeah,
family
do it
thing?
as that. Yes, let them be involved because that then when they're empowered and they feel like they're involved,
They're going to buy
we're
into it.
on board. Yep.
Yep. And then they see mom and dad doing it, their siblings doing it, they're doing it. And like I said, it's just going to improve everybody's quality of life, well-being, happiness,
Health, everything.
health. Yeah, everything. It's just, it makes everybody feel better when you sleep, because when you don't sleep, you feel like crap, and
Yep.
you don't feel good, and you don't
Mhm.
have the energy or motivation. And then you can get into this kind of cycle of sadness or frustration or guilt. You
Anxiety, there's
lost what's
everything that goes
the
with it.
purpose, yes, of all of these things.
Yeah, which is crazy because you don't realize it. So, and
Yeah.
I know we've touched on some of this because that's just kind of how it went, but I am still going to ask the question because I always ask it at the end of every episode. So, what are some of your final thoughts that you would want to leave with parents when it comes to sleep studies or sleep hygiene?
I think the most important thing is to remember you may go in and they may not find anything going on. Just because they order a sleep study doesn't necessarily mean there's something going on. It could just be, okay, we need to narrow down or figure out what is going on. And that could just
Good point.
be sleep hygiene changes or a medication change because they're on this medication that's causing them to have some sleep issues. Or you go in and you may get a diagnosis of something, and that's okay because you're going in, you're trying to find the help and support for your child. And so if they have to wear a CPAP mask or have some sort of support throughout the night, that's okay. It doesn't necessarily mean it's going to be forever either. It could be they grow out of it, or hey, we're going to do this in the meantime and make some changes and see if that helps support them. um, so many times people, especially in the adult world, I don't want to wear that mask the rest of my life.
Yeah.
I don't want to wear this the rest of my life. Okay, but why is the doctor having you wear this, right? Because you're not breathing for at least 10 seconds, more than 5 times an hour if you're an adult. That's a lot. It's hard to even hold your breath for that long, that often. And so understanding there's a reason for the treatment plan, and that it doesn't have to be forever. And the more you can educate yourself and ask those questions, the more you're informed and can make the decision that you feel is best for your child. And letting the kids know that there's nothing necessarily wrong with them if they have to wear it at night. It's just helping them breathe, helping keep that airway open so they can grow and be big and strong, and be
Yep.
good at school and be able to do whatever they enjoy to do. They're going to want to do it because they're going to feel better. So I think it's just important for parents, because it's easy to be like, oh my gosh, this is another thing, right? Or they're going to be on this the rest of their life. Well, not necessarily. Maybe as they
Mhm.
get older, they won't need it.
Right.
It's maybe just a short-term thing, or maybe they took their tonsils and adenoids out and they still need some support, but as they grow and their airway gets bigger, they won't need that support.
Hmm.
And so just asking the questions, don't be afraid to ask the questions. It can be scary. If it's not
That's
working,
huge.
treatment wise, your
Hmm.
mask isn't working, don't feel like, oh, I'm just going to throw it in the corner and not use it anymore. There's other masks out there, there's other options out there. Sleep is so new in terms of health care that there's so many things coming out. I was just at the Texas Sleep Society meeting, and just to see all of the new things coming out and hear all of the things coming out, it's amazing. And so,
Yeah.
in 10 years, I think sleep's going to look very different in terms of treatment options for patients and long-term options for patients. So, I think just take it one day at a time. It's okay. If something's not working, talk to your doctor about it. Get a new mask. Say, hey, I don't know what I'm supposed to be doing with this. That's okay. They don't expect every parent to know exactly what they need to be doing. It's daunting. Having your
It
kids,
is.
having your kids help you with it. If you need a therapist support in the meantime to maybe help with some acclimation therapy or anything like that, don't be afraid to reach out and see what kind of resources are available, especially if your kid's going to be on CPAP, and maybe they're really having a hard time with it.
Mhm.
School counselors are really great too. So my son was just diagnosed with a lot of allergy issues and has to do some allergy shots, and he was devastated. He's 8 and he's like, why? This is not fair. My brother doesn't have to
Mhm.
do this. And I reached out to his school counselor and she talked to him and he felt so much better. And I was like, that's a free resource, right? That's there for you.
Yeah, that's
Don't be
true.
afraid to reach out if you're feeling kind of stuck, or your kiddos maybe having a hard time understanding what's going on with them. Reach out to those resources, because if they understand what's going on with them, they're going to want to do the therapy, right? Whether that be some little changes here and there, or wear that mask or anything like that. And they know, hey, mom and dad are on board too, with what's going on. So
Yeah.
they're going to be more likely to do it and to buy into it.
Yep. Yep. And that's big. You've got to get them to buy into it, or
Yeah.
it's going to be a struggle for everybody.
If you struggle and, do you need to ask for another one from your DME company so their bear can have a mask on too, or, their stuffed animal can have a mask on too, or, little things like that. Finding communities, there's so
Yep.
many ways to connect with
Oh,
people
yeah.
virtually now, forums or support
Yep.
group, anything like that, so that you feel supported and you're not alone, because you're not alone as a
You're
parent. The
not.
child's not alone either. They're not the only one in the world with this. It's very
Exactly.
common. And so letting them know that, hey, yeah, it doesn't mean that there's anything wrong with you. It's just we want your body to be able to grow and sleep and support and all of those
Mhm.
things you learned at school. We want to stay in your brain. And so that happens when we're sleeping, right? We're processing all of those things and it's storing it. And so we're just wanting to support you while you're sleeping.
Yep, agreed. And it's so funny because some of these groups, we have the Airway Huddle, for example, is our parent support group, but there's others out there, and there's even some stuff I've seen people list on Pinterest. And if you're a crafty person, the funniest one I saw, and there is a little thing on there about how careful they had to be, but it's only on the outside. They painted a little bit of the
Oh,
mask
okay. Yeah.
so they could be Darth Vader. And I
Oh,
just thought, first of all, that parent and I need to be best friends. But second of all, that's brilliant because you're making it. I don't know what kid's not going to love that with the smoke coming out and thinking it's the
yes.
greatest thing. I
Yeah.
mean, I love that. So these groups
Yep.
are, you can find a way. You've
You
got
can
support
find a
out
way.
there.
And like after the Top Gun movie came out, you saw all those things on the internet of the men with their CPAP masks looking like they're in
Yep.
Top Gun. And so all of those kinds of things, find pictures of fighter pilots or whatever wearing the mask, like
Yeah.
smaller and cooler and see-through, and all of those things that
Mhm.
help them buy in and realize like, oh, this is kind of
And
cool.
it's
And
going to be okay.
yeah, it's gonna
Yeah.
be okay. It's totally fine. And I always tell my kids, I'm not doing anything to be mean or to hurt you. It's to support you and to make sure that you have everything that you can,
Yeah.
and everything available to you, so that I feel like, okay, you're supported in your health journey, whatever that may be,
Mhm.
and whatever I can do to support them. And so letting the parents know that by getting them to the sleep study, that's the biggest hurdle, because you relayed some concerns that you had and you're wanting to help your child and figure out what's going on with them. And so that's the biggest step, is just getting there and showing up. And everything after that, we can figure out and work through. And there's tons of support for you, and that you're doing the right thing for your child too.
Yeah. Yeah. You're
Probably
doing these short-term things for a long-term goal.
exactly. Exactly.
Well,
Yeah.
thank you so much, Jordan, for being here and for really kind of bringing it all together and just building on some of the things we learned in the other two episodes. So thank you so much.
Thank you for having me. I appreciate it.